What's the deal with milia and what are you doing that could be causing them?
And what is our derm-approved, pregnancy-safe skincare routine?
Also, what are the hacks that we swear by for using minoxidil?
And is your hormonal IUD causing your acne? We'll answer this and more on today's episode.
And if you have a pressing question for us, please drop it in the comments of this episode or send us a DM on Instagram at the Skin Deep MDs. All right, y'all, welcome back to another episode of the Skin Deep MDs. Today is kind of a fun one. It's kind of more casual. We asked you to send in your, hard pressed questions. We didn't ask me anything on our Instagram, and y'all definitely sent some really good ones. So we are here today to answer some of these or a lot of these.
Yeah, as you know, social media dermatologists, every time I throw up an ask me anything, I literally receive thousands of questions. So y'all are obsessed with skin and skincare and skin health. And there's a lot of questions that keep coming up over and over and over that I thought, why don't we just do a whole podcast on it? Like we want you guys to have your questions answered and we want to help you.
Definitely send in your questions. Or if you just want to send a DM, you can totally do that too.
Yeah. And before we jump in, we just want to send a big shout out to everyone who's been following along, who rates our podcast, who leaves comments. It means the absolute world to us. And if you haven't already, make sure that you download our episodes on Apple or Spotify. You can also watch the full episodes on YouTube. And please subscribe to our newsletter. There is so much cool information, a lot of summaries from the episodes, product recommendations, discounts and deals, all the good stuff. So you definitely don't want to miss out.
Totally. Lots of goodies.
All right. Well, let's jump right in. I have all the questions here. Okay. So one of my favorite topics, and everyone asks about this all the time, is tretinoin. And this question is tretinoin okay to use long-term?
Yes, I get that question multiple times. Tretinoin is definitely okay to use long term. We have studies going back to the 70s and or even before that. And tretinoin is actually supposed to be used long term, not only to help for those with acne, where it increases your skin cell turnover and decreases the clogging of pores and improves skin texture, but also for those who are trying to combat the signs of aging and sun damage. It helps remodel collagen to help with fine lines and wrinkles, and you can seriously use it until the day you die.
Yes. I mean, I've even prescribed it for kids before for, keratosis pilaris or in severe cases of baby acne. The only time it's off limits is when you're pregnant. Theoretically, you're not supposed to do it. There hasn't been any real hard evidence that it would hurt the baby. But with all that being said, it's better to be safe than sorry. And it's the only, for me, 9 months, 18 months, because I was pregnant twice, where I went without it. But the second I delivered, I was slathering that bad boy all over my skin again. Not on your nipples. You can't put it on your nipples when you're breastfeeding, but you definitely can use it on your face. The studies show that there's minimal to no absorption. There's no evidence that it harms the baby as long as it's not a premature child. You're not putting it on your nipples and you're washing your hands when you're done. But again, we've used things like tretinoin in, young kids for other reasons. So
yeah, definitely. Interestingly, when I was doing my research on tretinoin and breastfeeding, I learned that we also naturally have retinoic acid, which is tretinoin, in our breast milk. There is some of that naturally in there, which I thought was interesting.
Yeah.
All right. So let's see. Please send me some dry comedone prone skin friendly products as a gift. Wait. Well, okay. We could talk about some, products that are great for comedonal acne, but in people with dry skin. Cause I think, it's people often ask can I use this if I have dry skin, but acne? That's a commonly asked question I get. So, what are your thoughts, Lindsey?
So when we talk about comedonal acne, the gold standard is a retinoid, just like we were talking about. But you definitely wouldn't want to start with something like tazarotene or a really strong tretinoin, because if you have dry skin, it's going to exacerbate that and you're not going to be able to tolerate the treatment. Therefore, you are not going to get results and you're going to be pissed.
Hmm.
So if you have pretty bad comedonal acne and you're on the drier side or on the sensitive side, I always tell my patients, start with adapalene.
Hmm.
Adapalene is a retinoid, but it is on the lower side of irritability with still
Hmm.
pretty good results. And my tips are, you definitely want to realize that it's a marathon, not a sprint. So minimize the amount of days in a row that you are putting it on. So I tell people start out 2 to 3 nights a week, space those days out, apply with a moisturizer. If you're still dry with it, do a retinoid sandwich, moisturizer, retinoid, moisturizer, and avoid the areas that you get extra dry and sensitive and flaky from it. So that tends to be around the nose, maybe around the eyes, around the lips, on the lower face. So either avoid those areas or pre-treat with something like Vaseline and occlusive petrolatum to make sure that those areas aren't getting overly used or
Hmm.
too much retinoid on it.
Yes. No, I love that. I think that pretty much all skin can use a retinoid. It's just a matter of using the right one and using the right technique for it. And in terms of other supportive ingredients that I like for people who are prone to dry skin, like you said, moisturizer. I say look for moisturizer with also with niacinamide that can help with comedones, hydrating cleansers,
Mm-hmm.
and even like CeraVe makes active cleansers that have ceramides in them. So there are
Mm-hmm.
cleansers that can still help with comedones, like things with salicylic acid that also have hydrating ingredients. And
Mm-hmm.
if you want to like help with texture, I've been a big fan too of like polyhydroxy acids, which is hydrating as well
Mm-hmm.
as very gently exfoliating. So
Yes.
some other dry skin friendly products to help with texture and blackheads and whiteheads.
Okay. All right. Next question. What is the best collagen for improving skin? Or is it a scam?
Okay, let's see. You think they're referring to oral collagen?
I think we talk about both. Is
Yeah.
oral collagen effective for your skin? And is topical collagen effective for your skin? What's the deal? Is it a scam or is it legit?
Yeah, it's a very controversial topic, so it's definitely a great question. And I think that it's great that we're dividing into two topics because they both do different things. So with
Mm-hmm.
oral collagen, it's like a supplement, whether it's a liquid or a powder that can potentially be thought to help improve skin hydration, skin collagen production, texture. And it's interesting because most of the studies that are out there that are kind of decent, they're from companies that make collagen. So
Mm-hmm.
there's this inherent bias and it's hard to completely trust all of these. Um, I definitely am a fan of collagen. I think the evidence is pretty good for things like joint health and other aspects of our body that use collagen, whether it's like our ligaments and whatnot. But for skin, like I said, it's still a little bit controversial. For me, the type of collagen or the company, I guess, that has the best evidence, we still have to take it with a grain of salt because it's from the company, is a type of collagen called Verisol,
Mm-hmm.
Verisol, and there's different brands that incorporate Verisol collagen. So I think that it could do something, but I wouldn't be like, you have to buy it. It's part of
Mm-hmm.
your anti-aging skincare routine.
Yeah. I think it's one of those things that's a great addition on, but if you're not using a retinoid, you're not using sunscreen, don't expect miraculous results. But with that
Hmm.
being said, I definitely have incorporated it because it's low risk. There's, no side effects. It helps with other things in your body. And I know tons of cosmetic celebrity dermatologists who believe in this stuff. And so
Hmm.
that's something that I'm on board with. I mean, I don't necessarily like push it on all my patients, but if they ask, is it worth it? Can I add this on? I say, well, as long as the rest of your skincare routine's checking out, yeah, throw it on.
Yep, totally. Yeah, I don't think that it should be dismissed. I think that there's definitely compelling things with oral collagen.
What about
Topical,
topical?
yeah,
I think
topical
so. The
collagen's
the
different.
problem, yeah. Well, the issue, this is what's interesting about topical collagen is it used to be thought that topical collagen was too big to get into the skin, and that was true. But more and more brands that I trust, that I've met the scientists, I've met and worked with R&D, are coming out with collagen that is different. So
Yeah, more
what do you
collagen
think of,
peptides.
yeah, what do you think about topical collagen now
Yeah.
versus
So
before?
I completely agree. It depends on what the collagen is, like how large the molecule is. Are they using small peptide, like are they using small collagen peptides versus like larger collagen molecules? Small collagen peptides can potentially penetrate the skin. I do think that you don't need to dismiss collagen altogether, topical collagen, even if it is a larger molecule, because it makes
Mhm.
a great humectant. It can
Yeah.
provide a really nice hydrating effect. I think those masks, like those collagen masks, are an amazing humectant. Like you have the occlusive effect of the mask and you're getting that beautiful hydration. So I think that there's a role, but I don't expect, um, when if it says collagen on like the skincare product, that is automatically going to increase your collagen. You got to look at like the specific type of collagen that's in the ingredient list.
Yeah. So I think topical collagen, the answer is it depends. It depends on the brand, what products or what ingredients they use, and what your goal is.
Yep. Okay, next question. How do you get rid of milia? That is so embarrassing.
Okay, when you have milia, the number one question you should be asking is, are you causing it? Okay, so a lot of the
Mhm.
time it has to do with the products that you're using on your skin and what your skin type is. So if you're using something super occlusive on very thin skin like the eyelids, that can make your skin prone to milia. And milia are these tiny little balls under the skin. They're tiny
Mhm.
little cysts, and they're really frustrating, but they're benign. They're easily fixable. So number one, stop what you're doing that could
Mhm.
be occluding the skin. And number two, you need to make sure you're exfoliating your skin. So a lot of
Mhm.
the time it's
Mhm.
because you're maybe under exfoliating, or you
Mhm.
could be over exfoliating. I know it's tricky and that's
Mhm.
annoying to hear, but if you're overdoing it, you're destroying your skin barrier and your skin barrier is not healthy. So milia can be be occurring, or if you're
Mhm.
under exfoliating, you're having too much buildup on the skin and it's creating these little milia.
Mhm. Yeah, yeah. I know it's almost like sometimes it could be a reaction to like trauma, like we see milia and scars and whatnot. But I totally agree. You want to make sure you're looking at what you're doing. And sometimes they can happen for no rhyme or reason, and that's really frustrating. Some people are just naturally prone.
Mhm.
It's interesting, milia is not acne. It's a buildup of keratin under the skin, but it's different from acne. And I tend to see it in people who have more dry skin. I will also see it in women as they get older, so like more dry skin. And yeah, it can be frustrating. And honestly, the fastest way to get rid of it is to have it manually extracted. We recommend
Yeah.
going to a professional for that because you could potentially do some damage. But if you can't go in and see somebody to manually extract, then like you said, exfoliating, making sure you're also on like a retinoid to help with the
Mhm.
healthy skin cell turnover.
I love extracting a good milia, like,
Oh, so good.
so good. All
So
right, what else?
satisfying.
What else do we got here? Um, okay, we get this question a lot, which we will always continue to address because as moms, this is, a topic near and dear to our hearts is what is a good pregnancy safe skincare routine and what products did we love as dermatologists?
Yeah, that's always such a commonly asked question, understandably so, because we always want to make sure that we're doing all the right and healthy things while we're pregnant, because it's already stressful enough,
For sure.
with everything else we have to avoid, right? Like it's like deli meats or
Yeah.
sushi and not too
Sushi
much
and
caffeine and all this stuff.
yeah.
When it comes to skincare during pregnancy, I try to keep it pretty simple for people. I like to talk more about what not to use as opposed to all
Yes.
the things you can use, because
Yep.
you could pretty much use most things, which is
Mhm.
reassuring. But I like to say, what should you not use? The number one thing that I tell people, because it's the most available to over the counter, are retinoids. So whether it's
Mhm.
over the counter retinols or things like adapalene or prescription retinoids like Tretinoin and Retin-A, Tazorac, um, just because we have seen birth defects with, well, for sure with oral retinoids, Accutane being the main example. There have been some case reports with stronger topical retinoids like Tazorac. So we're like, just play it safe and avoid topical retinoids altogether. And so that's one. And then for anti-aging, when it comes to exfoliating products, this is a little bit more of a gray area, but for like alpha hydroxy acids, I say try to stay under a certain percentage, stay under 10%.
Mhm.
Salicylic acid, most products are 2%. I say, yeah, don't go higher than that. But you could use, vitamin C, niacinamide,
Mhm.
and, other antioxidants and peptides, your moisturizers.
Mhm.
And when it comes to acne, There are some gray areas with it. Of course, like I said, avoid retinoids. We talked about exfoliating products, try to keep that, more on the gentle side. And, but benzoyl peroxide, there's a gray area. I do tell patients it's okay to use like under, I mean, this is just me. I think that different derms have different perspectives, but I say like 5%. And, I prefer
Mhm.
washes because you can wash that off easily. It's not like staying on your skin, or things that aren't covering a wide surface area, like leave-on products that aren't covering a wide surface area, which
Yeah.
is rare. And yeah, there's some prescription things that we have to avoid when it comes to acne, but and sulfur, I think, is a gray area that's
Yeah.
available over the counter. We love azelaic acid
Hmm.
for acne. Yeah.
I think that the most important thing about pregnancy, other than the couple of things that are absolutely do not use, is you have to realize that your skin's going to change during pregnancy, and you want to
Mm-hmm.
just be gentle because your skin um, can fluctuate so much and be so temperamental that honestly, like less is more. You're going through it, right? Your body is
Mm-hmm.
changing. You are growing a human. Give your skin what it's asking for and what it needs, and whether or not that means you need to be more gentle with it, or you need to maybe start using some other acne products because you're breaking out, you have to listen to your skin and do what's best for you during those hormonal changes.
100%. Yeah. Not only is your body changing, your skin is changing.
Yep.
So yeah, but keep it gentle.
Oh, I got a good one. I think this is a
Okay.
super interesting topic. How do you apply minoxidil? How do you apply Rogaine? Because there's a
Ah,
right and a wrong way to apply Rogaine, and if you are not using it correctly, you're not going to get the results, and you're going to stop and you're going to be pissed.
yes. So Rogaine is my favorite over-the-counter product for hair growth. A lot of people don't a lot of people don't think it works because they're like, they use it for 3 months now, like they don't see results. I'm like, you got to use it minimum of 3 months. Sometimes it could take 6 months, sometimes even longer to see a
Yeah.
difference. And I get it. Some people don't like the messiness of a topical application, but when you use it, you want to make sure that yes, you are using it properly. For
Hmm.
me, it's just making sure that you are using, like, exposing the parts that you want to use it on so that there's like minimal hair in the way. And there's different forms. There's foam, there's liquid. Like if it's a liquid, you could apply directly on it. With a
Hmm.
foam, I like to apply it like on a little brush if you have access to it, and it
A
makes it so
makeup
much
brush,
like a
a
makeup
flat,
brush.
yes.
Yeah. Or like
So
a
that way
eyelash
it's not super
spoolie.
messy. Yeah.
Yes. Yes. Cause I know it is over. Yeah. It's annoying. That's the thing about topical products. It can just
Yeah.
get messy and annoying, but it could be more targeted with a little brush, and yeah, just gently apply it
Yeah.
to the areas with less hair.
Yeah. So these are my 3 hacks that I swear by as a dermatologist when I'm applying minoxidil, because I've used it too. So one is you have to be consistent. You have to use it at least once or twice a day. Two, if you want it to be effective, you need to be using at least the 5% minoxidil. It doesn't matter if it's the brand name Rogaine or not, and don't fall for the women's pink tax. So there'll be a women's Rogaine, it will say it's $50. There'll be a men's one or a generic one, it'll be 30. It's all the same. Don't fall for that marketing scam. And 3, I always prefer the foam over the solution because it's less irritating and a little
Mm-hmm.
easier to put in.
Yes.
Are
Yes.
there any hacks you
Super.
swear by for using Rogaine other than the makeup brush?
No, I think for me, you covered it. I do always warn people, side effects are rare. I mean, the irritation can happen more likely with the solution, but there is still a chance that you can get some systemic side effects. It's super rare. But people can get facial hair growth, and there's two ways that can happen. One is if it's like on their pillow and they're
Hmm.
consistently rubbing their face on it. I fall into that unfortunate statistic. Even with 2% minoxidil, I grow a
Hmm.
little mustache.
Oh no.
Yeah. So just a heads up on that, but hopefully you're not in that very, very minor statistic. And and I had one patient, interestingly, who reported ankle swelling. So ankle swelling is something we could see with oral
Mm.
minoxidil,
Hmm.
also super rare. Like I would say under 4%. But I had one patient get ankle swelling. So, just something to keep in mind. And
Yeah.
don't use it during pregnancy.
And two more things before we close this topic, which is uber important. If you have pets, keep your Rogaine, your Minoxidil away from
Mm.
your pets because it's
Mm-hmm.
toxic to your little friends. Shouldn't be a problem. Just, put it on your scalp, let it dry, and wash your hands when you're done. And then this is all over TikTok, so I think we need to address it, is people are using a derma roller with their Rogaine to make it more effective. And that actually is legit, but you have to be very careful with it. Make sure you're sanitizing it. You're using, alcohol to clean it when you're done. And it's just going to help with the penetration of the minoxidil and make it just a
Yeah.
little bit more effective. It's not make or break, but it can add that little extra oomph if you're looking for hair growth.
Yes. Love that. Yes. I forgot about the derma roller. Great tip. Okay. Next question. Hormonal acne and acne after IUD insertion.
Oh, okay. So
Mm-hmm.
I think that the tough thing is as dermatologists, we see this a lot more than probably what's out there, because
Mm-hmm.
someone, when they come into us, they already have severe hormonal acne, right? And it
Mm-hmm.
could be from their IUD. But in
Mm-hmm.
reality, the percentage isn't that high. So don't be
Mm-hmm.
afraid to go on a hormonal IUD if that's what's right for you and your life and your form of birth control and protection.
Mm-hmm.
But with that being said, it is a potential side effect.
Yep.
It probably should be talked about more. And you do have to treat it. You have to counteract that hormonal imbalance, unfortunately, with a systemic medication. In
Mm-hmm.
my professional opinion, I've seen this a million times. There is no topical that is really going to help when systemically you have this imbalance, because these IUDs only have progesterone in them and they're not balanced out with something like estrogen. So you would
Mm-hmm.
need something to counteract that. And I have very, very good success with using spironolactone in these women.
Mm-hmm. Yeah, I love spironolactone for progesterone related IUDs. And, and there's also a couple of different IUDs out there. There's some with, like, the Mirena has a certain amount of progesterone, and there's other ones
Yes.
that have a lower amount of progesterone. So
Yep.
that's something to look into if you still really like the IUD form of birth control. There's something like Skyla with a lower amount that may be helpful. It may not. There's also the
Mhm.
copper IUD that itself can come with its other issues. So there's trade-offs, because with the
Yeah.
progesterone IUD, it also kind of decreases your periods, and people love that.
Hmm.
Another thing that I also find interesting too, when people go on an IUD or get an IUD, oftentimes they may be stopping their oral contraceptive, and their acne flare could be more so related to that. Is
Hmm.
like their body was so used to whatever the
Yeah.
hormones were when they were on that. So sometimes it's hard to say. And for situations like that, I just say you got to, like, wait it out, give it at least six
Yeah.
months. It could be even longer, because
Hmm.
bodies take kind of a while to calibrate. But yes, you're right. Like, people who get acne from progesterone, it's a powerful force, and
Hmm.
that's hard to just tackle with topicals alone.
Yeah.
And when people are like, I want to get to the root cause of my acne, I'm like, get the IUD out then.
Yeah. So yeah, sometimes that's what it comes to. I always try
Hmm.
to do everything I
Of
can before
course.
that.
Yes, of
But
course.
it's not, again, I wouldn't say don't get an IUD because you're scared of getting hormonal acne. It's a
Hmm.
possibility, but if you already struggle with it, I would talk to your OB-GYN about other options.
Totally. I completely
So,
agree. Yeah. The statistics are really low. It's funny because, like, I even talked to my OB, and they're like, oh, it's not really, it's not really playing a huge role with acne. And if you ask derms, they're like, oh my God, it's playing such a huge
yes,
role with acne. We
exactly.
get
Because
such a
we're biased.
bias. We're so
Yeah.
biased. Like, everyone with acne comes to us. So,
Right.
but there's
Right.
like millions of people with
Right.
IUDs who don't have acne. So,
Right.
don't worry.
So I'd probably listen to the OB-GYNs on that one, but it is an important side effect to be aware of.
For
So
sure. For
I
sure.
think we have time for one more question. So let's make it a
Yeah.
good one. Let me see what y'all are asking, because these have been spot
I
on
love doing this.
I know when it comes. All right, this is my favorite topic to talk about. Okay, especially because you and I live in the South,
Uh-huh.
where it is hotter than Satan's armpit.
Yes.
Favorite deodorant
I knew
is
you were going to ask
natural
that.
better.
Oh, yes, yes. Oh my gosh. I know, such a hot topic, because there is such an inherent fear of aluminum in deodorants. And it started, like, back in the 70s, okay, where there was, and I don't know if it was in a study that showed that like, oh, could aluminum increase your risk of breast cancer? And there was another potential study or thought that it could increase your risk of Alzheimer's. And fortunately, since then, both of those ideas have been debunked with multiple studies and have also been backed by the World Health Organization, with the
Hmm.
breast cancer, like the Susan G. Komen
Yeah.
Foundation, American
Yep.
Cancer Society, the
Yep.
Alzheimer's Association. And so this fear is still ingrained in our society. And it's unfortunate because deodorants with aluminum are so much more effective. My
Hmm.
only situation where I don't recommend deodorants or antiperspirants with aluminum are if people are irritated by the aluminum, which is rare.
Hmm.
It can happen. I definitely see way more cases of irritation from natural deodorants that have certain fragrances or certain other additives in it. I think with aluminum, if I ever see irritation, it would be in like the higher percentage, like the prescription strength,
Yeah.
if that. So, yeah, but
Yeah. Here's
it
my
works much
problem
better.
with here's my problem with natural deodorants is you think you're trading it for something natural, and just because something's natural doesn't mean it's good for you, right? Like arsenic is natural, poison ivy is natural, but I don't recommend like rubbing it all over your pits because you're
Mm-hmm.
going to break out, right? And so they're using a ton of essential oils which are something that's highly allergenic, and
Mm-hmm.
it does not stop sweat, and it does very
Mm-hmm.
little for odor too. And
Mm-hmm.
so odor is caused by sweat mixing with bacteria on the skin, which produces that odor. And so when you're using a natural deodorant, all you're doing is putting some form of like fragrance on your underarms. It's not stopping the sweat, it's not getting rid of the bacteria, and it's causing a rash under the arm. So you're probably going to smell pretty bad if you struggle with body odor and you're relying on a natural deodorant to stop that. Now, with
Mm-hmm.
that being said, if you still don't want to use aluminum in your deodorant, then you definitely want to look for something that it at the very least has some ingredient that's going to target that bacteria in the skin. That way you can lessen
Mm-hmm.
the bacteria so that there's less body odor. And what I prefer for that is using something like benzoyl peroxide or a really, really low strength glycolic acid
Mm-hmm.
or hypochlorous acid. So those are
Love
all going
it.
to reduce the bacteria on the skin so that there is no body odor, but it will not stop sweating.
Yeah, exactly. I love that. Like if really all you care about is the body odor and you don't want to use something to stop sweating that's effective, like with aluminum, then
Yeah.
love that hack. Just like benzoyl peroxide, a low strength glycolic acid, or hypochlorous acid.
Yeah.
But yeah, I agree. I can't tell you how many, like I see way more armpit dermatitis cases in people who are using these natural deodorants, and it's frustrating because I understand like you want to do what's best for your health. I
Mhm.
I totally get it. um but it's potentially causing more issues than good, so.
Yeah. So at the end of the day, if that's what you want to do, you're not having problems with it, then you do you, boo, but you will not
Mhm.
catch a dermatologist applying natural deodorant. You just won't.
Mhm.
I have said my piece.
Yep.
And with that being said, we literally had 100 questions and we've gone through like six because that's why we're on a podcast, because we are Gab Central here. But please
Yes.
continue to submit your questions. We promise we'll try to get to more. I really enjoyed doing this episode
Mhm.
because we are responding to you, to our listeners, to our followers, to people who
Mhm.
support us. So keep
Mhm.
submitting your questions. Be sure to tune in every Tuesday. We're always going to drop a new episode on Tuesdays. Be sure to give us a 5-star rating. We would love that. Download our episodes. You can find us on Apple Podcasts. You can find us on Spotify, and you can watch everything on YouTube. We also have a newsletter. Be sure to follow along for all the deets.
Yes, lots of goodies. Yes, we're at the Skin Deep MDs. Don't be afraid to send us a DM. We will read it. Don't worry. We have a whole team of people here, okay? And yeah, this is fun. So we'll definitely do more. Thank you
Tune
so
in
much.
Tune in next Tuesday and we will see you then.
See y'all.
Bye.
And if you have a pressing question for us, please drop it in the comments of this episode or send us a DM on Instagram at the Skin Deep MDs.